Deion Sanders is expected to undergo emergency surgery for a blood clot in his groin, as was reported earlier today on the Pat McAfee show. And in this video, we'll try and provide a little bit of insight into what exactly could be happening. Welcome back, everybody. I'm Dr. Brian Sutterer, and my goal in this channel is to help teach you about the medical side of the world of sports. Deion has been dealing with complications and issues in his foot for some time. I made a video talking about the toe amputation procedure he had done last year. And I think if we actually go back to a recent video uploaded with his medical team, we'll get more insight into what probably is going on here with this now news of emergency surgery for a blood clot in his groin. The first clue here is some mention about an aneurysm for Sanders.
But the clotting from an aneurysm is something that the blood thinner would be important to be on long term.
The first mention here is about blood clotting from an aneurysm, so implying that Deion is dealing with some aneurysm somewhere in his body, presumably maybe up in the groin, based on this recent news. And they're talking about the importance of being on blood thinners, because as we'll review in a second, aneurysms can have this propensity for clots to develop based on the way that blood flows through them. So point number one here is we're dealing with some sort of aneurysm, which is an expansion or kind of a weakening in the blood vessel that causes it to balloon and dilate outwards.
Arteries, it's supposed to be this big around your groin, and it's, like that big around.
That's another point about this aneurysm. So the artery in the groin, we'll look at our anatomy tool, but typically femoral artery, iliac arteries are going to be about the size of your pinky. So the aneurysm in the artery causes it to expand and grow. As this doctor is saying here, the artery is bigger in Deion's groin than it typically should be from presumably an aneurysm.
And when blood, coming out of an artery this big goes into one this big, it slows down. And it layers out in a slow flow, and then it forms clot, just like the deep river runs, slow.
So it just keeps kind of forming on top of it.
And so there's a wall that has slow flow, and that layers clot. Your body automatically, if it's going slow enough, it clots. Then if you hit that or do something to it, stretch it, or it gets up thicker and thicker, then some of it breaks loose, and then it goes downstream and lands where it gets to a small artery, like down in the leg. And I think that's what's happened with you.
Now, more information about this artery and kind of what happens with why it clots. Let's look next at our anatomy tool to understand locations and some context here. So what I've shown initially is just the entire male circulatory system. Red is going to be arteries, blue is going to be veins. And you see we have just tons of veins and arteries scattered throughout our body. The arteries are going to send blood from the heart out to the rest of the body. So in the groin, the femoral artery, blood is moving from the heart down to the foot. The veins are the reverse. Blood is going from the outer portions of the body back up to the heart. And the general trend here is that the blood vessels, including the arteries and veins, the closer they are to the heart, the bigger they are. And then as you get further away from the heart, they get smaller and smaller and smaller until ultimately at the end tissues, you have these capillaries, which are tiny little microscopic blood vessels that we can't even see if we just were to look at the tissue. So you start up at the heart, the aorta, big blood vessel size of a garden hose, and as you work your way down into the abdomen, into the groin, out into the feet and the extremities, those arteries get smaller and smaller by design. If we get rid of those veins and just focus on what's going on kind of in the groin here with the arteries, first of all, we have the abdominal aorta. People can get aneurysms, or again, ballooning out expansion focally of that artery because of some sort of weakening typically in the wall of the blood vessel. You get an abdominal aortic aneurysm that's pretty well known. Those arteries then split into the common iliac artery, and then the common iliac artery splits into the external iliac and the internal iliac artery. The internal iliac artery goes deeper into the pelvis, helps to supply the gluteal arteries into the muscles of the pelvis, and then the external iliac artery turns into the femoral artery. The femoral artery is the main artery down in kind of the front of our groin that you can push on, maybe even feel your pulse, but that then continues down to the thigh. Arteries get even smaller down into the leg, and then all the way down into the foot, where we can now compare and see how tiny and small these little blood vessels are in the foot compared to that big, thick garden hose of an artery up in the aorta. So what all these doctors seem to be saying is that in Deion's groin, there's an aneurysm in one of these blood vessels. Whenever you have an aneurysm, you transition from a narrow, kind of normal-sized artery to suddenly now this big outpouching of an aneurysm. And from a physiologic perspective with blood flow, whenever that happens, blood is coming in up here really fast. And then it hits this change in diameter where the diameter gets bigger from that aneurysm and the blood flow slows down. You now get this kind of stagnant blood flow within this aneurysm. And whenever blood is stagnant, it has a tendency to clot. So then in part of this aneurysm, you get thick blood. You get blood clots that can form. Doesn't really cause any issue if they stay in place, but then if a piece of that clot breaks loose, now suddenly you have this small little pebble, this small little clot that's traveling downstream the rest of the blood system. Now, it doesn't cause problems yet until it gets to a spot where it's big enough that it causes a blockage. When we get down closer to the feet, of course, the blood vessels are smaller, and so they're more likely to get blocked from a smaller clot. It sounds like this is what the doctors are concerned about here, that something is shooting off what we call thrombi, these mobile clots that are traveling down the leg into the bloodstream and then get to the end of the blood supply down in the foot, block off, plug up the blood supply, and then when the blood supply is missing to the tissue starts to die. In terms of what procedure Deion's actually undergoing, it depends. There's a lot of different stuff depending on exactly where the aneurysm is, in which one of these blood vessel branches, what the extent of the clot is. There's other things that can happen to the arteries like dissections, where you get a weakening with a little abnormal flap that can actually rupture within those blood vessels. So it depends on where it is and what exactly is going on, but that's the underlying anatomy and just concept of why they think there's all these complications and issues. Aneurysm forms. Aneurysm can generate slow blood flow, which can cause clots. Clots can then break off, shoot down the rest of the blood vessels into the extremities, block those blood vessels, limiting the blood supply, limiting the oxygen supply, which can lead to death of the tissue. Now on Pat's show, he also mentioned something about, blood clots after surgery. They can go up, they can kill you. That's true, but that's usually the case of a venous blood clot or a pulmonary embolism. A lot of people have probably heard about a DVT or a deep venous thrombus. Those are clots that occur deeper in the veins, typically of our extremities. And remember, blood in the veins is going from the extremities back up to the heart. After it gets into the heart, there's no oxygen in that blood, so that blood has to go to the lungs to become oxygenated. A pulmonary embolism is when a blood clot forms somewhere else in the body, in the veins, not the arteries like we're talking about here for Deion, goes back up into the heart, goes into the lung, and gets stuck in the lung, limiting blood supply, oxygenation of the blood, which can then, of course, be fatal. So different pathways, different mechanisms, different structures that are involved. But again, yes, clots, very concerning, especially when we're talking about big pulmonary embolism clots, or what appears to be more likely with Deion here, blood clots that can form in the arteries and then travel out to the extremities and cause tissue blockage and cause tissue death. That's it for the video, everybody. Let me know, as always, any questions or comments down below. Hopefully everything goes well tomorrow with Deion. If we get any other news or updates, I'll try to do a new video with the updated information, but hopefully this was still educational to look at the anatomy, talk a little bit about aneurysms and what's likely going on here with why these complications are occurring. Thank you for watching, and I'll see you in the next video. Bye.